Show you is on here. So first of all, frontal sinus. Unfortunately, I actually can't see the frontal sinus on that model. So let me turn the lights on and show you the frontal sinus. Right here's the frontal sinus. Right here's the frontal sinus. And while we're at it, this is the sphenoid sinus. So show the rest of the class. This is the frontal sinus. It's right here in the frontal bone. And this is the sphenoid sinus. It's in the sphenoid bone. And you should also realize that there's other places I can ask you this. For example, on these torsos right here, the frontal sinus has been peeled away. I mean, the bone has been peeled away. Here's a frontal sinus. Here's a frontal sinus. And likewise, one of these skeletons has a flap on the frontal bone. And you can flap it up and see the frontal sinus. I don't know which one it is. You can look around one of these skeletons, you can see the frontal sinus. Lots of places you can see the frontal sinus, like right here. By the way, what's the function of a sinus? Anyone know yet?
Make the skull lighter.
Make the skull lighter. And some of these sinuses have another function. Voice resonance. So that's the frontal sinus. The supraorbital foramen. The supraorbital foramen, I'm going to turn the lights off now, is the two holes in what you would call your eyebrows. These are supraorbital foramen, right here and here. By the way, what do you think these foramen are called?
Suborbital.
Infraorbital. Good guess. Infraorbital. That's an infraorbital foramen. That's an infraorbital foramen, and these are supraorbital foramen right there and there. Okay? So far, so easy. Okay, the parietal bone. Let me get the top to this guy. I'll swap out. This goes on here like this. All I'm going to do is take the top off and just show you this. This whole bone right here is the frontal bone. And the frontal bone is fused with these two parietal bones here and here. The suture is called the coronal suture. It's in the coronal plane. So this is the coronal suture, and it's in the coronal plane, so that makes sense. So this is the frontal bone. These are two parietal bones right here. All right, this is called the sagittal suture, and it's in the sagittal plane. So that makes sense. That's the sagittal suture. It's the fusion of the two parietal bones. Any questions about the parietal bones? Now let me put this on here like this. The temporal bones are right here. This is a temporal bone on this side. This is the temporal bone on this side. So this is frontal, parietal, temporal. This is the squamosal suture. The squamosal suture right there, separating parietal from temporal. All right. In the temporal bone, I have where my ear canal is. This is called the external acoustic meatus, or sometimes the external auditory meatus. It's right where the stick is. It's the hole in the bone where your ear canal runs. The external auditory meatus. Then there's a styloid process just inferior to my external auditory meatus right there. That's my styloid process. If I turn this whole thing over, make sure you can see it. Here's the styloid process here. Here's the styloid process here. Now you're going to say, well, there's a whole bunch of styloid processes in the body. You bet. Stylus means pen. All these styloid processes are pointed like a pen. Okay, what's next is the styloid mastoid foramen. Well, before I get to that, let me tell you that this big bump here and this big bump here is called the mastoid process. So mastoid process, styloid process, mastoid process, styloid process. There's a little hole in between them. It's called the stylomastoid foramen. Foramen means hole, of course. All right. Now, you have to know what runs through that hole. Cranial nerve 7 runs through it. That's the facial nerve. When I get done here, I'll show you a way to memorize cranial nerves if you want. We really cover them all in this lab because you have to know what runs through these foramen. And I'll help you know a way to memorize them if you like to do that. You have to memorize it for 204 anyway. So cranial nerve 7, or the facial nerve, runs through the stylomastoid foramen. Now, this is a little bit tricky right here. The zygomatic bone, etc. Okay, this is the temporal bone. So this is the zygomatic process of the temporal bone. All right? Now this is the zygomatic bone. And this is the temporal process of the zygomatic bone. I said that correctly. This is the zygomatic bone, and there's a process running backwards towards the temporal bone. So this is the temporal process of the zygomatic bone. This is the zygomatic process of the temporal bone. Where those two processes come together make this zygomatic arch. This arch is called the zygomatic arch. But it's tricky because this is the temporal bone and this is the zygomatic process of the temporal bone. This is the zygomatic bone and this is the temporal process of the zygomatic bone. The temporal process of the zygomatic bone and the zygomatic process of the temporal bone fuse right there. They fuse at that orange line you see, and they become the zygomatic arch. So that's a little bit tricky. We already did the mastoid process, but I'll do it again so we go in order. This is the bump right behind your ear you can feel. That's the mastoid process. The sternocleidomastoid muscle attaches there. By the way, that muscle, sternum, cleido, clavicle, mastoid process. So later on you're going to learn a muscle that attaches there to the mastoid process. All right, the carotid canal of the temporal bone. Now, let me show you something. Let me take the mandible off. How easy will that come off? Well, I'll just turn it like that. All right. I'm going to name all of these foramen for you in a second. This is the carotid canal right there. That's the carotid canal. All right. Now, I want to show you something. That's the other side carotid canal right there. I want to show you something. You can't see that carotid canal from the inside. From the inside, I can see the foramen magnum. I can see the hypoglossal canal. The stick is coming up through it. So foramen magnum, hypoglossal canal, jugular foramen, internal acoustic meatus. But I can't see the carotid canal in here. So, by the way, on one of the real skulls you can, because the bone broke down so much you can actually pass a stick through it. But it turns, so you're not typically able to run a stick through that. But from this side, I can certainly see the carotid canal right there. Here's the jugular foramen, and here's the carotid canal right there. Here's the carotid canal right there. So foramen magnum, hypoglossal canal, jugular foramen, carotid canal. All right, the internal carotid artery runs through that, and I want to show you something else. This right here, this whole circle of Willis you'll learn this semester later. This is the internal carotid artery coming up and through. If I turn this sideways, here's my common carotid artery. Here's my external carotid, and here's my internal carotid. You can trace this internal carotid right up, and you look at it and say, oh yeah, look at that. My internal carotid artery is right there. It comes through the carotid canal to get into the skull. It's outside the skull when it's down here. It has to get into the skull. How does it come through? The carotid canal. So you can look at this model and see that carotid canal as well. All right, the jugular foramen. I'm going to show you both sides. I always orient with this is foramen magnum. There's a hole here, and I'll stick the stick from the bottom up. That's the hypoglossal canal, and we do cover it. But there's the foramen magnum, hypoglossal canal. This is the jugular foramen. That's the jugular foramen right there, and that's the jugular foramen on this side. All right, where are we? Look at 9, 10, and 11 run through the jugular foramen. Cranial nerves 9, 10, and 11. Glossopharyngeal, vagus, and accessory. Glossopharyngeal, vagus, and accessory nerves all run through that jugular foramen. 9, 10, and 11. All right? The internal acoustic meatus is pretty simple. This is the external acoustic meatus that we mentioned already, right above the styloid process. The internal acoustic meatus is right here. Now think about that. The sound waves go into your ear through the external acoustic meatus. They hit your eardrum and vibrate some bones, and a bunch of stuff happens. And then the nerve must fire. Well, that nerve has to get to your brain. It's actually your brain that's doing the hearing. You know, your brain hears for you. The nerve just transmits the signal. Well, how does that nerve get to the brain? Through the internal acoustic meatus, where that stick is sticking right there. Here's the internal acoustic meatus on the other side, right there. Now, cranial nerve 8 travels through the internal acoustic meatus. That's the vestibulocochlear nerve. No problem there. But there's another one that also travels through it. The facial nerve travels through it. So 7 and 8 travel through the internal acoustic meatus. All right? 7's actually traveling out of your brain, out of your skull, to your facial area. The vestibulocochlear nerve is actually traveling into your brain. But they share that canal, the internal acoustic meatus. All right, the occipital bone. So let me put this back together. The occipital bone is right here. And it has some bone markings on it. This suture separating the occipital bone from the parietal bones is called the lambdoid suture. And it's Lambdoid. Lambdoidal or lambdoid suture. And it's Lambd. It's not misspelled on your sheet. It sounds like you should be saying lambdoidal, but the D is silent. You just say lambdoidal. So this is the lambdoid suture or lambdoidal suture. This is the occipital bone. On the occipital bone, you have to know a few things. First of all, you have to know this. Let me get the jaw back on there, the mandible back on there correctly. You have to know this foramen magnum. The big hole, that's the foramen magnum. You have to know. Oh, that's easy. Your medulla oblongata travels down through that, and cranial nerve 12 does also. No, I'm sorry. Cranial nerve 11 does also, not 12. 12 travels. 12 is called the hypoglossal nerve, and that travels through the hypoglossal canal. 11, the spinal accessory nerve, travels down through the foramen magnum. The occipital condyles. I just turned the skull around so I could see them better. Condyles are smooth articular surfaces. These are the occipital condyles. They sit on C1 vertebrae, which is called the atlas. Matter of fact, the joint is called the atlanto-occipital joint. So these are occipital condyles right here on both sides of the foramen magnum. All right. Right here, this is called external occipital protuberance. This is called the external occipital protuberance, this big part right here. But at the very tippy tip of the big part of the external occipital protuberance is this inion process. Oh, down? Oh, thank you. This is called your external occipital protuberance. This whole thing I'm encircling. But the very tip of it is called the inion process. And that's that bump you feel in the back of your head. Your trapezius muscle hooks there. These are called nuchal lines. These roughened areas coming off of that. You actually should have a superior and an inferior nuchal line, but I'm only seeing really one set of nuchal lines. When you do traction on someone who's unconscious, you know how you come up behind them and you put your fingers underneath their head and you pull on their neck to give them neck traction. You're putting probably your middle finger on their external occipital protuberance, and you run your other fingers on the nuchal lines and you just pull. And then you sit there and hold traction until the paramedics get there and put them on a neck board and all that. So you actually palpate these when you're putting traction on somebody. All right, what else on the occipital bone? The hypoglossal canal, you have to look from the side, so I don't know if Kendall's going to be able to see that, but the stick is in it. Oh, you can see it right there. That's the hypoglossal canal. It exists on both sides of the foramen magnum. In cranial nerve 12, the hypoglossal nerve runs through there. So there's one there, and there's one here. Now, it's very important you guys look at these foramen from both sides, the inferior side of the skull and from internal. Because you'll see it's tricky. Here's the foramen magnum, here's the hypoglossal canal. And here's what I would do. I'd put my stick through the foramen magnum and I would turn it over and say, yep, foramen magnum. Now that's an easy one. I would put my stick through the hypoglossal canal and turn it over and see where it comes out. And I would do this for all of them. I might as well give you the saying we have for these foramen right now, then I'll hit them again. We have a saying starting right here. We skipped the hypoglossal foramen, hypoglossal canal, but the saying is this: Michael Jordan, now I can't see the carotid canal, so I can't see it, but it's right about there, can shoot over LeBron routinely. So Michael Jordan can shoot over LeBron routinely. And it stands for this: Michael is magnum, jugular is Jordan, C is carotid canal, but I can't see it from this side, remember. I have to turn it over to see it. Shoot is spinosum, foramen spinosum. Over is ovale. There's the ovale, foramen ovale. LeBron is lacerum. There's the foramen lacerum right there. And routinely is the rotundum right there. Now here's what you got to do. Now you can't put your stick all the way down through the spinosum. You can't do it. Oh yeah, you can. I just forced it through. I don't know if I should have done that. Usually it won't fit because it's not big enough. But I have the stick in the, let me do the jugular foramen. Put your stick in your jugular foramen, turn it over and say, oh yeah, there's the jugular foramen. Put your stick in the spinosum, turn it over and say, oh, there's the spinosum. Now look at that. Since my stick broke, I'll take advantage of that. Here's my carotid canal, and here's my carotid canal. So Michael Jordan can shoot over LeBron. Now you're going to say, where's rotundum? Where's routinely? Let me show you. Let me stick my stick through there. I just broke another stick. And it comes out way down in here, right below the inferior orbital fissure, which I'll cover as well. So you really do have to spend some time and stick some sticks through these. I have to get that stick out of there eventually. Okay, so let's get back to our list now. We're done with occipital. Now let's do sphenoid. And can you throw me a couple sticks from that box right there? Oh, you're filming. Who's not filming? The sphenoid bone is this funny shaped bone right here in the center. And it has a greater wing, which, don't get confused, the greater wing is inferior. This is the greater wing of my sphenoid. And this is my lesser wing, which is superior, but it's a lot smaller. See how my lesser wing up here is a lot smaller than my greater wing down here? And I want to show you something. If I go into the back of the eye and I put that stick through the optic canal, and I go in the back of my other eye and I put this stick through the optic canal, I want to show you what happens. These sticks cross. You see where those sticks cross? They cross right over top of the sella turcica of the sphenoid bone. Sella turcica stands for Turk's saddle. It's Latin for Turk's saddle. And it looks like a saddle. This is the sella turcica of the sphenoid bone. The pituitary gland sits there. Now, those sticks are actually emulating the optic nerve, cranial nerve number 2, running through the optic canal. If the pituitary gland swells, what do you think it does to the optic nerve? Presses on it. Pituitary adenomas cause visual aberrations and blindness because pituitary adenomas press on that optic nerve right there. That's how anatomy and physiology are related. In a lot of ways, you say, well, why are you blind? Because you have a pituitary adenoma right there. That pituitary growth presses on those optic nerves. All right, so that's the sphenoid bone. Let's keep going. Sella turcica we just did. Greater and lesser wings. Lesser wing, greater wing, greater wing. The pterygoid plates are seen down in here. This is a lateral pterygoid plate of the sphenoid. This is the medial pterygoid plate of the sphenoid. This is the other medial pterygoid plate, and this is the lateral pterygoid plate. This plate in here is where the vomer and the perpendicular plate fuse to make two nasal cavities. This plate right here is not a pterygoid plate. It's the fusion of a perpendicular plate and a vomer bone to make your nasal cavity into two. Separate your nasal cavity into two cavities. So lateral pterygoid, medial pterygoid, lateral pterygoid. Notice the P is silent. It's not pterygoid, even though it's spelled that way. The optic canal we just did, but I'll show you again. When you look in the back of the eye right there, you see this laceration here and this laceration here. This is called the superior orbital fissure, and that's called the inferior orbital fissure. But that nice round one right there is the optic canal. And likewise in this eye, you have that nice round one right there is the optic canal. So the optic canal is the nice round one. The other ones are fissures, superior orbital fissure and inferior orbital fissure. So that's the optic canal.
These are not going to be disarticulated either. They're all going to be.
Yeah, these are all articulated. I do have an exploded skull above the countertop over there, but I won't use that exploded skull for this anyway, not for the foramen like that. It'll be an articulated skull. You can see what runs through these. Cranial nerve number 2 runs through the optic canal. By the way, cranial nerve number 1 is your olfactory nerve. Cranial nerve number 2 is your optic nerve. So the optic canal, cranial nerve number 2 runs through. Look at your superior orbital fissure. 3, 4, 5, and 6 all run through it. The ocular motor, the trochlear, the trigeminal, and the abducens all run through the superior orbital fissure. 3, 4, 5, and 6. Look at the inferior orbital fissure, part of the trigeminal nerve. Tri means 3. The trigeminal nerve splits into 3 nerves. Remember, I'll show you the trigeminal nerve. This is the huge trigeminal nerve right here. And it splits into 3 branches, right here, and right here. So of course the trigeminal nerve is going to run through more than one foramen. It's going to, because it splits into 3 major nerves, which in turn split into even smaller nerves. So you'll see trigeminal nerve, cranial nerve number 5, passing through many foramen for that reason. All right, where am I? Superior and inferior we did. The foramen ovale we did, but let me show you again. Carotid canal you can't see. There's the spinosum, there's the ovale, there's the lacerum. So spinosum, ovale, lacerum. Spinosum, ovale, lacerum. Spinosum, ovale, lacerum on that side. The one that the stick is in, no longer, is the rotundum. And there's the rotundum on that side. Any questions about those foramen? All right, why don't you guys videotape and take a break. Make 2 videos instead of